allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Air Tamer Personal Air Purifier. It's easy to have filtered air with an Air Tamer Personal Air Purifier. An Air Tamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Air Tamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Air Tamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code AgelessHealth and get a 10% discount. Order today.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hi, everybody. It's Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live and moving into Ageless Health Radio. And we have a very special program for you today, one that I'm very proud to do. And the reason for it is simply this. It's the answers that you need to get to make sure that you understand the rights that you have relative to your health, that you are your own advocate. But to know how to do that, you have to have very special, if you will, knowledge base, people who really get it, who understand it, who can walk you through the process. And I'm very honored today to have as my guest not only a friend, but somebody who I think is beyond the cut, somebody who knows constitutional law and administrative law better than anybody I've ever met, someone who is going to open the door for your own advocacy as time goes on. He's been up against the FDA 8 times and won, opening the doors for you to choose health. And we're going to ask him some very difficult questions today, and questions that nobody gets asked. And by the way, just because I'm very supportive of this man, Jonathan Emord, I will have anybody on this program if they want and are willing to ask or answer the questions that I'll ask them. Having said that, I'd like to introduce a very dear friend, somebody who's running for the United States Senate from the state of Virginia, Jonathan Emord. Jonathan, thank you for saying yes today. I know it was a stretch for you to do this, but I appreciate it. And I'd like to get into the program. But anyway, I hope it's going well for you. I hope your campaign is turning the corner. It's exciting. We've got a few months left, and we need people like you.
Well, thank you so much. It's always a pleasure to be with you, Dr. Roselle. And the campaign's going very, very well, thank goodness. And I think we are going to save our state and save our country if we get everyone out to vote. So I hope they will. And I think we've got just a few more months now of really strenuous effort to ensure that we get the right president. We also get the right senator for Virginia.
Jonathan, I want to start out by kind of revisiting this last 4 or 5 years and in the time of COVID. A lot of mandates, a lot of people lost their jobs. Kids were set aside. If they refused to be vaccinated, they lost their educations, they lost positions, they lost scholarships. Athletes, same thing across the board. And those who refused have begun to set a standard. There's a group that I've been working with, and it's called Feds Against Mandatory Vaccines. But what I want to start with a question to you is that, did the federal government have the right to impose the sanctions or restrictions that we went through over the last few years? We've always had quarantines. My family came over from the old country, and they went through Ellis Island, and the doctors came aboard the ships, and then they also checked them at Ellis Island. And then once they determined they were fine, they let them go. The Spanish flu, the same type of thing. They quarantined sick people, not well people. Were we duped?
Yes, our rights were violated. This is the greatest betrayal of Americans in our history. We were forced to both be censored by the federal government. We couldn't communicate information critical of the vaccines without having the White House and CISA, the White House entity, collude, and the FBI collude with big tech to censor information relative to treatments other than the vaccine. And in addition, we were forcibly vaccinated, coerced or cajoled into it, and kids were forcibly vaccinated. All of this against their independent autonomy, their right to determine for themselves how best to be treated. The masking situation, likewise, a gross violation of your personal autonomy. And then, of course, we found out it was built upon a lie. So this was an exercise of power, not based on individual evidence of illness and need in a particular case, but rather an attempt to cause healthy people to be forced into a treatment regimen and a masking regimen against their will, oftentimes, and many times through false information. They were induced to do this. This is the biggest betrayal we've ever had. It is a situation where that horrible F word, Fauci, really did cause us irreparable injury. The United States will never be the same because of this. We shut down businesses. We caused kids to lose years of education. We encouraged them into environments that were really increasing their psychological injury. And we've seen so many youth suicides as a result of this. And yet they still persist with this emphasis on vaccination, despite the fact that when you're vaccinated, you can still get COVID, which means that it's not really a vaccine. If you're vaccinated, you can carry COVID and give it to other people. And then all of the adverse effects associated with the vaccine coming out in all of the Pfizer information, we realize all too starkly that this is the most virulent vaccine we've had in American history. No change in the trajectory of COVID in this country. We had 1.1 plus million people who died during the pandemic phase. The vaccine really did virtually nothing to prevent that, and probably contributed to it by reducing immune system protection for people and by also exacerbating inflammation effects, which have invited all manner of symptoms rising from the vaccine itself. So it's been a disaster.
That's what we're seeing on a day-to-day basis. We're seeing so many patients that come in with cardiac problems, and the lie is so prevalent that that you talk to a traditional allopath, that they buy into the system. It had nothing to do with it, but we know if you go in and you read the journals, you go into PubMed, you go to the Townsend newsletters, and so forth. Even going to the CDC sites, they actually now are forced to admit, if you look deeply into the literature, that these things are causing. But people are coming in, cardiac arrests are taking place constantly, and it's unfortunate. So here's the thing: informed consent. What happened to informed consent? A patient is supposed to be given the right, both the good news and the bad news, so to speak, what actually takes place, what the expectations are. But that was set aside. We didn't see that at all. Why?
Well, we didn't see that. We also didn't see any long-term testing of the vaccine. They rushed it into production. And then in addition to that, now the boosters haven't even been tested at all. And this is the mark of a government that is proceeding on political grounds, not science. People who were induced to take this vaccine, a lot of people fail to realize that when it causes this inflammation reaction, when it makes your own DNA make the spike protein and it goes throughout and attaches to the ACE2 receptor sites all over your body and causes an inflammation reaction throughout your body, that leads to all manner of precipitous early onset of age-related disease. And what we have seen is that everything from Parkinsonism to heart disease to diabetes to cancer appears to be triggered as a result of the inflammation reaction to the vaccine. So people will have a latent condition that they're unaware of that manifests itself in a patent manner because of the inflammation reaction. So what we are going to see, unfortunately, are generations of individuals manifesting age-related disease prematurely with a massive cost to the public, to Medicare and Medicaid, and also, of course, the American taxpayers as a result of that. But in addition, we're going to see a lot of deaths, as we are seeing them now and have been. Premature deaths, deaths of people in their youth, deaths of people who really could have had a lot longer to live without age-related disease, but have been forced to succumb to that because of this trigger. And it's insane because, ivermectin and hydroxychloroquine actually are effective early treatments as well as various nutritional treatments. You've mentioned various treatments that are early treatments that are quite effective. Those who have been Dr. Roselle's patients during all this have benefited greatly. The public was led to believe that the vaccine was safe and effective. They were lied to about that. They were lied to about first they were told that if they were vaccinated, they would not get the disease. That was a lie. They were told that if they were vaccinated, they could not carry the disease. That was a lie. They were told that if they were vaccinated, they would have more fulsome immunity than if they actually got the disease, and that is false as well. And then they were told that if they were masked, that would reduce the spread of the disease. That was utterly false. The virus is a nanoparticle and can pass through a single strand of thread. There's no amount of masking that you can do. Then they went into this ridiculous phase of saying, well, you need 2 masks. No, you need 3. Utterly absurd. I guess if you put 150 masks on a face, you might suffocate the patient to death, and then dead, they would not transmit the disease. I just don't understand why we went into this zone of censorship. I appreciate the underlying motivations ultimately, which is total control. A decentralized environment is how we ordinarily deal with medical issues, and it's been very successful. When we allow individual practitioners to experiment and determine what's in the best interest of an individual patient, we have far better outcomes than when you have a government one-size-fits-all approach nationally imposed, as was done here, with a whole propaganda campaign that denied people access to information, and with a censorship campaign that denied them access to even more information.
John,
This is not a good thing to do.
I've got a question. A lot of finger pointing in this that supposedly gave states the right to lock everybody down, the government directly to stem off of, and as far as I'm concerned, they misinterpreted across the board. You're the constitutional attorney, the 10th Amendment, if you will. But it goes beyond that. When I had the privilege of speaking on a forum with you, I brought up the fact that in the Affordable Care Act, there's kind of a little segment that everybody kind of overlooked. And it actually manifested in Australia and New Zealand. And what it said is that the government, in concert with local medical authorities, in the case of a pandemic, could decide what the fix was, whatever medication, vaccines, or what they had to do, everything that we saw. The next piece was that if they felt that somebody was a threat or a group of people were a threat, that at their discretion, and they felt that it was a public threat, they could pull them out and put them into a quarantine holding camp. Is that valid, or is that something that has been just kind of spread whimsically?
Well, as I said at the start of the program, if you have an individual case of contagion with one person where they're infectious, you would be able to exercise power. But you see, under both the Fourth Amendment, which requires probable cause for an action that would result in your detention, that's an imprisonment action, or would compel you against your will to receive some medication, you would need at least probable cause to proceed. They have no probable cause here. They're going against healthy people. In addition to that, under the 14th Amendment, actually in the 5th Amendment, because it's the federal government, you have a liberty interest in your personal autonomy, in controlling what you ingest, what environment you wish to live in, transportation, for example, travel, deciding where to go to a restaurant or so forth. When those things are encumbered by the state, that violates your rights under the Fifth Amendment to the Constitution, your liberty rights. And when they take away your right to decline from being vaccinated or to decline from wearing a mask, what they are doing is taking away your liberty rights. And you need to understand that. And that raises a major constitutional issue. And I believe that they're on the wrong side of it, because they cannot prove in a case of a healthy individual that individual poses a risk to anyone. And so they imposed a mass set of requirements, both at the federal level and at the state level, where they deprive people of their individual liberty as well as their economic liberty. And as you know, I represented Matt Strickland at Gore Meltz and fought against the ABC board, and we succeeded there in getting all of his license back and so forth. But they had an armed raid at his restaurant. They took his license away, and we prevailed ultimately against the state. But that's the kind of draconian enforcement that occurred all over the country from governor's orders, which shut down businesses, and that violated their rights very clearly. There was no foundation for proceeding like this. In addition, they acted without legislative authority in many instances. The President of the United States would act without legislative authority, and so would the governors. And these matters are inherently legislative. Even the legislature wouldn't ultimately have the right to, or the power to violate your rights. But in the nature of things, the executive has no independent power to make law by compelling people to not go to work or to be vaccinated if they go to work in a business of 100 or more people. That part was found to be unconstitutional by the Supreme Court on the separation of powers basis, that it's a power of Congress, not of the president in the first instance.
Jonathan, I do my homework, and because I have to brief different organizations in my world. And I came across something a while back that I had totally forgotten about. It was the Commerce Clause, Section 361. It's called Public Health, Service Act, and there's a code in there. So how does that apply to what happened? Because that's another piece that I've read in a lot of different legal writings recently that says that's what gave them the right to shut things down. Is that just something they're throwing out there in cannon fire, or does it have some application to this?
Well, I'm an advocate of the framers' intent, the original understanding of the Constitution. And the Commerce Clause was not meant to debilitate commerce. It was made to facilitate commerce. In other words, if a state imposed a barrier through taxation or tariffs to prevent another state's goods and services from coming into that state, that would be a Commerce Clause related issue as the Founding Fathers understood it. We've had this long, unfortunate extension and expansion of the Commerce Clause to embrace virtually everything. And that really has enabled the Commerce Clause to consume the entire Constitution. You shouldn't have your rights violated as a result of the Commerce Clause. Your rights are protectable independent of the Commerce Clause. The Commerce Clause was never intended to be a vehicle for the federal government to deprive you of your rights. And that's what happened here. Your liberty interests, your liberty rights were violated when you were forcibly masked and coerced or cajoled into vaccinating yourself or your kids. So
what can be done, Jonathan, to stop this from ever happening again?
So when I'm elected to the United States Senate, I'm going to introduce legislation that will make it impossible for the government to impose a mask or vaccine mandate of any kind, including even getting rid of the CDC's vaccine schedule. We need a patient-centric system of medicine in this country where patients and doctors, not the federal bureaucrats, determine what is in a patient's own best interest. And in addition, a lot of people suffered injury as a result of what the government did, most notably those employed in hospitals, doctors, nurses, firemen, policemen, people in the military. All of them were variously coerced, cajoled into getting this and forced to get it, the vaccine. And many of them were forced into retirement or were fired. For those people, this legislation will require every institution that receives federal funds to rehire them, to allow them to have the promotions that they're due, and to give them the back pay that they're entitled to. The government should pay for the damage that it has done directly to those it hurt. And that means those military people who've been kicked out or forced into retirement. And that means the doctors and the firemen and the policemen who have been abused and kicked out of service. And we sorely need them all across the United States. This whole thing was a fiasco. Recognize that a lot of crime, a lot of death has happened as a result of the depopulation of medical care personnel in the military. We have a terrible we have a shortage of needed servicemen. And then likewise, from decimating police departments and hospitals, and we need to fix that, and we can, and it's critically necessary that we do it. And so I
Jonathan,
will.
I assume that's part of your medical freedom restoration initiative that you're going to head up.
That's right.
It's
Right.
important. We've been set aside, we've been duped. Even now, the fear patterns run so deep. We have patients that are walking, and obviously, I support them where they're at. They're coming in masked. They're coming in gloved again, and the foolishness, not on the patient's part, but on this cascade of misinformation that is affecting our society across the board is taking us apart. One of the last questions that I have for you is this: you've been back and forth to the U.S. border several times, and supposedly, we have laws that we don't need new laws. We just need to enforce the laws that we have on the books, and then fund enough border agents to do the job and to process properly, and then to have the ability to restrict, hold people, and permanently send them back. But the piece is that these people are coming through with tons of different disease processes, and that by itself is setting an infectious pattern that may turn into be a tsunami that we're not even thinking about. What about that?
Yes, this whole open border situation is a planned destruction of the United States, a destruction of our nationality, a destruction of our economy, and a plan really to allow those that mean to actually take violent action against us, including sex traffickers, drug traffickers, and terrorists, to come into this country with impunity, no restriction whatsoever, no vetting. Every single person coming in is not required to abandon their national allegiance and adopt allegiance to the United States and to the Constitution and the laws of this country. In fact, we now have a massive illegal population in this country, depriving Americans of jobs and also inviting those who come in to understand that no matter what they do illegally, they will be able to stay. And when it comes to this whole issue, when you go to the border, you see just how stark and horrible this is. They have taken the Border Patrol away from the border by and large and have put them into human processing. And that means, under Alejandro Mayorkas, within 72 hours, individuals coming into this country calling themselves asylum seekers are processed. And what processing means is signing them up for welfare, signing them up for food stamps, signing them up for Medicaid, and giving them cash, American tax dollars. Family of four can get over $3,000 in cash. They give them a tax ID number, which they can then use to get a driver's license. In some states, like Maryland, you can actually vote with that tax ID number. And then in addition to that, they put them into geographical groupings, and then they take them to the train station, bus terminal, and airport. And at those locations, there are fully federally funded non-governmental organizations, and they are buying the tickets for them to go all across the United States. It's not 8 million illegal aliens in this country. It's something like 20 to 30 million, and this is going to destroy us. And this is with full knowledge. The Biden administration is encouraging, incentivizing the illegal migration invasion, if you will. It really is an invasion. And the Constitution provides against this. The commander-in-chief is obliged to make sure that the laws are faithfully executed. He's not doing that with the immigration laws, and he's not functioning as a commander-in-chief to defend the borders. So you end up with really a dereliction of constitutional duty by the president, and for the supporters of the president, like Tim Kaine, you get an equal endeavor on his part to ensure that this destructive agenda is maintained at the great expense of everyone in the country. In Virginia, we're losing 5 people a day to fentanyl overdose. Fentanyl's pouring through the border. That number is going to increase by roughly 60% next year, we believe. And the amount of sex trafficking in Virginia and drug trafficking in Virginia is incredible. We have a crisis that has been created by the government of the United States. They do not respect our rights. They are not protecting the American citizen. Tim Kaine has done nothing to secure the border or to protect Americans' rights and interests against this invasion. So we need some accountability in Washington, and that's going to start when we get rid of Biden and we get rid of Kaine.
Jonathan, moving forward, the primary, the Republican primary is coming up, and God willing, you will get the nod, as I pray every day that you will. At that point, I'd like to do this. I don't know if I can make it happen, but I'll do everything I can possibly do to make that happen. I'd love to have a medical freedom roundtable between you and Tim Kaine, and I will sponsor.
I would love it.
I'll see if I can make that happen. That would be a great, because you know that I'm going to ask some pretty tough questions.
Quickly, Tim Kaine has introduced legislation that will actually facilitate World Health Organization centralized control over medical medicine in this country. He's actually introduced the bill as the primary sponsor to take away our rights to doctor-patient relationships and to deprive us of the freedom of choice in any instance in which WHO would declare a medical emergency, not just COVID, expansively any instance in which they would declare a medical emergency. And the World Health Organization is really a proxy for the CCP. So his bill is enabling the CCP to control American medicine in the end, and it's an outrage. And no one has really seriously called him on it other than me. And I would really like to see some serious inquiry into why it is that Tim Kaine has supported such an awful piece of legislation against our rights and interests.
Well, we'll see if he says yes, and I do everything that I can to possibly make that happen. It's people need to know. My program is about simply, people being their own advocate when it comes to healthcare, knowing what their choices are, truly knowing what's legal, what they're being put upon, and ultimately with that information, making the choices that are right for themselves and right for their families. And because at the end of the day, health it's a do-it-yourself program for them. And until that takes place, until that's given back to all of us as citizens of this country, we're lost. And I'm excited for you. It's not often, matter of fact, over the years that I've even begun to get involved in any kind of campaign, but we so desperately need people who understand it. And when I saw your background and what you did, and because of you, people have the right to come to people like me. And you established that at the Supreme Court level years ago. And I thank you for that. But we're going to make it happen. Jonathan, continued good luck. It's always a pleasure, but let's do this again.
Thank you so much, Dr. Roselle.
Take care, my friend.
Take care.
We're at the end of the program. We're going to say, we'll see you next week with another interesting. And by the way, those of you who are listening that lean to, Tim Kaine's platform, very seriously, reach out to him and tell him once the Republican primary is over, I would love to have him and Jonathan Emord sit at a table and allow me to ask questions, the same question to both of them. You deserve to hear what is being said. You deserve to know what is being proposed and is coming down the pike that's going to be part of the control mechanism that they're going to have on your life, your children's life. There's too many people dying today. I have people coming into my office and they're ending up with coronary plaquing and neurological degeneration and autoimmune conditions that they should not have had. And it's a result. And the first question I ask anybody today, a new patient when they come in, or even old patients that reactivate and come in, is one question: were you vaxxed? Did you have the boosters? And then I start asking other questions in addition to that. We are at a precipice. We are at a time where we have to begin to change our leadership in the healthcare arena and in the federal government, because, my dear friends, it truly is about your choices. With the right information, you need to be informed. You need to see both sides. You need to see, the right, the left, in between, and then do your homework. Remember what I've said forever? My job is to provoke you. My job is to make you think. My job is to make you go do your homework. And then once you do it across the board, not listening to the talking heads, they have an agenda. And, on one side, you get blatant lies. On another side, there's lies of omission, too. You don't get the full perspective. With people like Jonathan Emord and others like him, and I'm not saying across the board relative to political, but human beings like him, intellectual capacity of his level, you deserve to have that information. You have a great day. We'll be back next week with another interesting program, to say the least. Remember, I love you all. See you then. Bye.